Hello everyone, my name is Corbin Biswas, and today I'm presenting Smart EHR Summary AI, a digital health solution designed to help rural healthcare providers quickly access the most important patient information within electronic health records. Healthcare professionals spend a large portion of their time reviewing patient records and completing documentation. My product focuses on using artificial intelligence to streamline that process and improve efficiency, particularly for rural healthcare providers who often work with limited resources and outdated systems. To begin, the problem this solution addresses is the significant amount of time healthcare providers spend reviewing patient records and documentation. Electronic health records contain large amounts of information, including patient history, medications, lab results, and previous visit notes. Providers often need to manually sift through all this information to identify the most important details. This process slows down clinical workflows and reduces the time doctors can spend interacting with patients. In rural hospitals and smaller clinics, the problem is even more severe because these facilities often face staff shortages and limited IT infrastructure. As a result, healthcare providers experience higher levels of burnout and reduced efficiency in delivery care. The primary users of this product are physicians, nurses, and other healthcare providers working in rural hospitals and clinics. These providers manage complex patient records every day and need faster ways to access critical information. The buyers for this product are typically clinic owners or hospital administrators who make purchase decisions for healthcare technology. Both groups share similar needs. They want tools that reduce administrative workload, improve efficiency, and integrate easily with existing systems without requiring major IT investments. To address this challenge, I developed the concept for Smart EHR Summary AI. This is a lightweight AI-powered tool that integrates directly with existing electronic health system records. The tool automatically extracts key patient data and generates a prioritized summary that highlights the most important medical information. For example, it can prioritize abnormal lab results, medication history, recent diagnosis, or other critical data. The summaries are customizable, allowing physicians to organize the information in ways that align with their workflows. The goal is to make it easier for healthcare providers to quickly understand a patient's condition without spending excessive time reviewing long records. To better explain how the product works, there is a simple four-step process. The first, system syncs with the clinic's existing EHR platform. Second, the AI analyzes patient data, such as medications, lab results, and medical history. Third, it generates a concise patient summary that highlights the most important information based on the physician's customizations. Finally, the physicians can customize the summary and integrate it back into the electronic health record. This process allows providers to quickly understand a patient's situation and make more informed decisions. The market for this type of solution is significant. The AI augmented healthcare software market continues to grow rapidly as healthcare systems adopt new technologies to improve efficiency. For rural healthcare providers in the United States, the total addressable market for solutions like this is estimated at approximately $1.65 billion annually. After accounting for budget and infrastructure limitations, the serviceable available market is around $1.09 billion. This demonstrates strong potential for growth, especially as rural healthcare providers increasingly adopt digital tools. Additionally, the serviceable obtainable market for the augmented AI healthcare market is around 6.5%. To address the competitive landscape and to give the investors a better idea, several companies currently operate in the AI clinical documentation space. For example, Avo provides AI-powered clinical assistant tools, while OrbDoc focuses on affordable EHR integration for more rural hospitals. Furthermore, Think Roman offers AI documentation tools for smaller clinics. However, many of these competitors either focus on larger healthcare systems or lack advanced AI features. Smart EHR Summary AI differentiates itself by combining advanced AI capabilities with customization specifically designed for rural providers of different physician types. The business model that my product plans to run on is a subscription model. Healthcare providers would pay between $49 and $99 per provider per month, depending on the features included. The pricing structure keeps the product affordable for smaller clinics while still generating recurring revenue. Customer acquisition would focus on direct sales to rural clinics and partnerships with rural healthcare networks. In the future, additional revenue could come from licensing partnerships with larger EHR vendors. My development roadmap follows three phases. The first phase is the minimum viable product, where a prototype is developed and tested with healthcare providers to validate usability and the willingness to pay. The second phase is the beta stage, which involves more pilot testing with a larger group of providers and building partnerships with rural healthcare networks. The final phase focuses on scaling the product by expanding partnerships and automating onboarding for new customers, as well as focusing on developing relationships with pre-existing EHR companies. In the first year, the primary goal is validation and early adoption. Revenue is expected to begin around month 9 after pilot testing and early partnerships. By the end of year 1, the projection includes approximately 9 early customers and around $7,140 in revenue. More importantly, the tool has the potential to significantly improve clinic efficiency. It could reduce administrative time by about 30%, lower administrative costs by about 25%, and increase patient throughput by roughly 15%. The team structure to successfully run my program is as follows. I will serve as the founder and product manager, overseeing development and strategy. Specialized roles such as software development, design, and business development will be filled by other contractors. This approach keeps costs manageable during the early stages while allowing the team to scale as the product grows. Specifically, as mentioned before, aiming to create strategic partnerships with other pre-existing EHR companies. Finally, my call to action. And in conclusion, Smart EHI Summary AI is trying to address a critical challenge in rural healthcare by reducing administrative burden and helping providers quickly access the most important patient information. By combining AI technology with affordable pricing and rural healthcare customization, this solution has the potential to significantly improve healthcare workflows. The next steps, which is what I need help with from you, is securing pilot partnerships with rural healthcare providers, continuing product development, and establishing strategic partnerships with EHR vendors. Thank you for listening. I look forward to your questions.